welcome to this edition of All About Hopkinton, the original HCAM series created to bring you the people and organizations that help make our community the great place that it is. I'm your host, Mary Arnott. There are a lot of people dedicating their time, energy, and talents to improve some aspect of life in our town. I'm honored to be sitting here talking with them and sharing their stories with you. I'm honored today because Karen Spilka, our state senator, is joining us now.
Thank you, Mary.
Welcome, Karen.
Thank you
so much.
It's my pleasure to be here.
Well, I know you have a very busy schedule, so I'm particularly grateful that you could take time out to be on the show today.
Oh, of course, this is fun. Yeah.
Well, we'll try to make it fun. I like to start by asking you a little bit about your background, whatever you want to share with the viewing audience about who you are. Everybody knows you, but we have a lot of new people in town, so whatever you'd like to share.
Well, thank you, and thank you for inviting me. It's great being here. I guess the one thing that I want to share to people, because sometimes people ask me, why do you do what you do? How do you take it? I mean, it sometimes is very frustrating, but it's also incredibly rewarding. So, what I say to people, I was a social worker. I started out as a social worker, actually. I grew up in a family who, my sister had Down syndrome, and I ended up being her legal guardian for 20 plus years. My father had major mental illness. And I say that because I think it's really important for people to know that the impact that it has on the rest of the family and what happens. And then my father passed away when I was in college. He also had a major heart attack and just died. So it's no surprise that I became a social worker to help people, help kids and families. And that's what I did for a few years, went to law school, came out as a labor lawyer, and then went into conflict resolution. So I bring those skills to the State House, and I really feel that all of that, both my personal and my professional, helps me be a better legislator in responding to folks from Hopkinton, their needs, whether it be individual constituents or issues for the town or for Metro West or statewide. And that's why, to me, I feel like I still do social work, but on a broader scale.
Well, thank you for sharing that very personal background. And as you say, I think there are a lot of things that happened in your life that certainly have contributed to your being a great senator for our state of Massachusetts. And you do cover quite a large territory for the district that you have. I was looking at all the towns, and you must put a lot of miles on your car. Well, speaking of all the things that you do as a senator, why don't we start with the recent storm knocked out power for a lot of people, and I know that you've been putting a lot of effort and time to getting Eversource to help bring back power for everyone.
Right. I know Hopkinton still has many households that do not have power. The Metro West, I'm hearing from my other towns and cities. So early this morning, I think I had heard that Eversource sort of left most of the towns at around 10 o'clock last night, and the towns were not expecting that. So even some of them had planned on schools this morning when it wasn't as the situation wasn't as good as anticipated. So early this morning, I started making phone calls and texting people, and have been able to get crews to Hopkinton, Ashland, Framingham, Holliston, and my other surrounding towns, impressing upon Eversource the need to get the power back, that this has gone on for too long. I realize that the demands on the east part of the state are really high, and that Central Mass has seen, we saw a lot of snow. It was heavy snow, there was wind, and that there are a lot of down limbs and down trees all over. But if they need to call people in, people are in their homes without electricity, without heat, and it's not good. So we really need to do something. So the anticipation right now is to have power restored tomorrow. Many homes will be better today, have it restored tomorrow at the latest, which is good. They have been responsive to my phone calls and pushing. So I'm working with them on that, like I did with the gas gate that was originally planned for Hopkinton that, I worked with Carolyn Dykem and I sent a letter in protest. I worked very closely and hosted meetings with John Coutinho and the Board of Selectmen, Town Manager Norman Kamalo. They came to my office at the State House, had the Executive Office of Energy and Environmental Affairs. We had Eversource. We had people. It was very clear that not only should there not be a gas gate on Elm Street, but there shouldn't be one anywhere in Hopkinton. There should not be the expansion. And I was thrilled when Eversource just recently announced that they were backing off and not doing that. So it was a real team effort.
Yeah, thank you for sharing that, because I was going to say thank you very much for your efforts to help make sure that gasgate didn't happen. Even though I was not anywhere near where it was going in, I had attended meetings because I was absolutely, saying, no, you can't do that to that neighborhood.
Right.
And so we're all very grateful in Hopkinton for your efforts and your results.
Well, thank you. It was a team effort, and I think that the results are wonderful.
Yeah, so you're no stranger to Eversource.
Right.
They know you well. Good.
They do. I'm on speed dial.
Well, something that is extremely important to let everyone know is that you are the chair of the Ways and Means Committee, an extremely important committee with all of the work that goes on for budget and finances for our state. So I invite you to tell us about that.
The Senate Ways and Means Committee does the Senate version of the budget. The governor presents his budget in January. The House does theirs in April. We in the Senate produce our budget in May. So I start meeting now, and I've been meeting with the senators, getting their priorities, their personal, their district, their statewide. I meet with advocacy organizations and compile all of that into a budget that I produce. And then we debate it. We add to it via amendments, the debate at the end of May. And then I am the Senate lead conference committee person to negotiate between the House to hash out the differences to get the bill on the governor's desk. When during the course of the year, there are supplemental budgets that we have to do because there are needs for caseloads that are unforeseen for certain programs, could be food stamps or the Council for Public Service or other things. And there are needs that arise during the course of the year, and we usually have at least 2 or 3 supplemental budgets for that as well. My committee also vets. We are the committee that vets most of the bills. We have about 8,000 bills that are filed every 2-year session between the House and the Senate. And they go through the whole committee process, and then most of them eventually end up in the Ways and Means Committee, at least 90% of them. And so we take a look at them and vet them and get a fiscal note for each one and put it out on the floor and sort of work through the amendments that each senator files to get to a final bill so that we pass it, and then it'll go to the House of Representatives. And then again, if there's differences, I am very often involved in the conference committee of those bills as well.
Well, I'll tell you, I have a hard time just arguing with myself on my own little house budget. I can't imagine you having to pull all that together with so many people involved, but it's a lot of work there. Excuse me. Speaking of money then, and the Ways and Means, there was, I understand, recently a large bond bill that had passed. And many things involved with the bond bill and where that money is going. So I invite you to tell us, where is that money going?
Okay, well, that dealt with capital costs for the state buildings. There were some municipal buildings, higher education. So I'm proud to say I was able to put into that bill $2 million for the town of Hopkinton, the town hall, for renovations to town hall to help. We'll need to lobby the administration, but we'll hopefully get that. I was able to put funds in to fix the district court in Framingham that Hopkinton residents use, but to also do a feasibility study for a regional justice center that would help increase access to justice for Hopkinton residents and other Metro West residents, and really make a difference in many folks' lives. I was able to put some funds in for Mass Bay Community College. This region of the state, we have both Mass Bay Community College and we have Framingham State University. So I was able to put some funds in to keep Mass Bay right here in Metro West, because they have a great partnership with many of the high schools here, and Framingham State University, the hospital, because they do a lot of allied health training and degrees for many of our healthcare professions here. There's a lot of wonderful synergy, and it will be needing to leave its current location in one of Framingham's old middle schools, because Framingham needs to reclaim that middle school. So we're trying to work out to plan for Mass Bay to stay. And there was some funding for Framingham State University as well. So, I've tried to keep the region in mind when I do bond bills, and there's, an environmental bond bill coming up and others, and they, again, all come out of my committee.
Well, I think I read it was something like 3.65 billion in bonds or something,
Yeah.
and there's a lot more in there. I know you can't go through everything because there's a lot but it's going to be money that's going to be put to good use in public safety, clean energy, and some other things. So,
Right, yeah.
So there's a lot in there. Thank you.
So there are ways to sometimes direct some funds for Hopkinton, either it be the DCAM or like the budget. We mentioned the budget. I was able to put $100,000 for Hopkinton organizing for prevention. It's such a big deal with the opioid crisis. I so believe in the local community organizations and programs that can do so much for education and prevention. So I was happy to do that for Hopkinton as well.
Well, I'm glad potentially the $2 million for the town hall and the money for the to fight the opioid crisis. And speaking of that, let's talk a little bit about healthcare. There's a lot going on too in terms of some bills, I understand. Patch that somebody referred to it as for short.
The Patch Act.
The Patch Act and some other things.
Right. Well, the Patch Act was a bill that I filed working with the Connors Center for Women based out of Brigham and Women's. I discovered that many healthcare insurance companies, not all, but many of them, if you go see a provider and then the insurance company sends an explanation of benefits to your home, it's sent to the subscriber, not always the patient. So in many cases of domestic violence, or sometimes now that children can be on their parents' plans until they're 26 years old, but they don't necessarily, they're adults, they're working, they're independent, they may not want, they want their explanation of benefit to come to them. And other cases, particularly, we found that victims of domestic violence were not seeking medical attention because they were fearful that their explanation of benefits would go to possibly the person who was causing the domestic violence. So it's a simple bill. PATCH stands for Protecting Access to Confidential Healthcare Information. So it just says that the explanation of benefits should go to the patient, not the subscriber.
I never realized it didn't because I'd always provided my own health care plan, and I didn't realize that information could go to somebody else.
Right.
So
you'd think that it would be against the law under the federal HIPAA regulations, but this has been going on for years. I don't get it either. So it's simple. It's an easy fix. I worked with the insurance companies. They're all on board. I worked with all the other organizations. So it passed in the Senate a few weeks ago. Last week it passed in the House of Representatives. I'm working with the sponsor in the House. There's just very minor changes that I think it'll be on the governor's desk within a week or two at most.
Wonderful. I'm glad to hear that.
Yeah, thanks.
There was something else going on in the healthcare arena as well. Transformative Healthcare Act for cost containment and access, I guess it was. I made a little note here. So.
Yeah, this was a major piece of legislation that the Senate passed last fall. We had been working on it for a year. We all hear about how we need to start controlling the rising costs of healthcare. Healthcare is about 40% of the state budget. From somebody, we have a $40 billion budget. 40% is a huge chunk of it, and it's continually growing, and so it's making it harder and harder to put more and more funds to education and all the other, local aid and all the other programs, special needs and whatever, veterans, seniors. So we looked at other states' best practices, and we literally worked with a foundation who helped us go to Minnesota and work with people in Seattle and Washington and Maryland to see what they have done to rein in costs. So some of it is reining in costs for Medicaid to lower those costs. Some of it is private insurance and looking at best practices. As I said, we worked on it for a year. I was part of the working group, helped write it with the head of healthcare finance, and I'm proud we produced a very a thorough bill and comprehensive bill where we sent it to the House, and that's where it is now. It would lower the cost of healthcare if we can get it passed.
Okay, so that's still in the works.
Yes, that is in the House right now, and hopefully they will produce a bill, and then once they have their final bill, we would negotiate and come to some resolution of the differences and hopefully get a bill on the governor's desk before July.
So controlling costs, hopefully getting them down, which helps maybe with access for everybody to be able to afford the health care and also save money for the state.
Right,
and the communities.
right.
Sounds good to me.
Thank you. I agree. We need to do it.
Yeah, I hope it reconciles quickly there.
Right. I agree. I agree.
Okay, so that's a little bit on health care. I didn't want to slight the opioid crisis. I'm really glad for the money. I don't know if there's anything else you want to talk about there because it affects so many people, but I feel like I brushed over it a little bit.
Yeah, I could just mention that last session we did a major opioid prevention bill. Previously, we did an opioid prevention because of the growing numbers of fatalities and the opioid, the pills that are out there. We first focused on treatment and recovery because we needed to, because people were dying. Last year, and again, I was chair on the Senate of the conference committee to really hash out and come up with a very strong bill. So we worked with the House, we worked with the governor's administration, and we came up with a bill with many first-in-the-nation provisions. We were the first state to have it. We had heard you have a tooth out, a wisdom tooth out, you'd get prescribed 60 opioid pills. That's ridiculous. So we limited it to 7 days. You could not get more than 7 days. If you need more, you have to go back to your doctor and pick it up. And if you decide, even if you get 7 days, again, first in the nation, you go to your pharmacist and say, I only want 2 days, you can get what was called a partial fill. No other state had ever done that before. We mandated, we strengthened the prescription monitoring program, so before a provider could even give you a prescription for opioids, they have to check that monitoring program and see, oh my gosh, somebody was at such and such doctor 3 days ago, and they're doctor shopping for more opioids, no. And so they couldn't do it. We mandated provider education, not only on opioids, but alternatives to pain medication, and so on and so on. And so it has become a first in the nation, and I am very proud to say that we have finally reverse the curve. The fatalities were going up. We provided bulk Narcan to communities so that communities could have access to it at either low or no cost, so that people could be revived. And we have finally reversed the curve, and we are down 8% in fatalities. So we need to keep that going. We need to continue to focus on prevention and education, and that's where Hopkinton Organizing for Prevention as a community organization is so important. But we also need to increase the treatment. We've increased the number of beds the last few years in the state by over 1,000, the different levels of treatment. And we also need to help with the recovery end. So we're working. The other thing that, as you heard my background, we need to focus more on mental health. Mental health, so many of addicts and people with substance abuse have mental illness. I mean, this is a disease and we need to be treating it as a disease. So we need to help people get the services. We need to increase the number of programs and services for people that are in need of mental health services. We need to make sure that there's insurance, mental health parity in insurance, and we need to get rid of the stigma for mental health. These are issues that are really personally and professionally important to me.
I couldn't agree with you more. And all those efforts, even if it only saves one life, it's worth it, but it's going to save a lot more than just one.
I think so too.
Thank you. Speaking of people and family, Paid Family Leave Act and the Youth Advisory Council are something also that are very near and dear to you.
Right. The Youth Advisory Council I started a couple of years ago, and I have a couple of students from every high school in my district, including the Voc Tech School. So I have about 20 students that come. We rotate. We have meetings in the State House. They get a tour. There's 2 students from Hopkinton High. They're terrific. I'll tell you, this has really made me, feel our future is very secure. These kids are terrific. They're sharp. They're bright. They're inquisitive. They ask great questions. They come to the State House, they get a tour, we give them a list of my bills, and they can pick and they partner as to which bills, and as if they were a legislator, would they be for it, against it, what reasoning would they have, making arguments to try to persuade others and to really act as a legislator. So we meet sometimes in the State House, sometimes in the district, and each year we learn from the prior year, and we grow and we change, and it's been a great experience. I really enjoy it, and I hope all of the students do too. And then my paid family leave bill is a bill that I've been filing. I do believe that it helps both not only working women and their children, but families and men as well, because it's for paid family and medical leave. And the companies that have it now, just as many men take advantage of it as women. And I think it really helps strengthen the bonds with the kids. People have become much more loyal to the company. They're more productive when they come back. And it's a great way to remain, for Massachusetts companies, I would love for us to pass it, to be competitive, to keep our workforce here and have an edge among the other New England states, because this is a benefit that will really help people stay in Massachusetts, and we want to retain, all ages, but especially those who come here or are here for college. We want to make sure that we retain their wonderful expertise and skills that they have gone to school for.
Well, I had the good fortune of working for a company that provided paid family leave.
You're
I
lucky.
didn't realize it wasn't available to everybody. I have a lot to learn, but I just thought that was something most companies do.
No, that
Yeah.
some do, and that's great, but not all do. And your experience is wonderful. My experience, I did not get paid leave when the 2 times I had my sons, and it was tough. It was tough. I took 4 months the first time. I tried 6 months the second time, but it was very tough.
Yeah. Well, I'm glad to see the efforts on that. And also on the Youth Advisory Council, not only are, you hearing about the things that are important to young people, but you're aspiring them, to have that link to politics, and maybe some of them will be our future politicians. And
I hope so, and I urge them, and for anybody that's listening, if they want to get involved in politics or government or just try it out, we have an internship program that goes on during the year at the State House and in the summer as well. So say if you're in college and you are away, you can certainly, it's a volunteer, we don't have the money to pay for it. So we try to work out with the students, time-wise, and we have students as well during the year. So we have a lot of college students. We have some law students there working, and that's great. They really learn a lot. They go to hearings, they answer calls, they do constituents, they do a lot of everything. They really get a feeling as to what goes on. I try to have them sit in some of the meetings and just get a real expansive experience. And so we have that. We have other things going on, but it's wonderful, and we need for people to get involved. I've been very impressed on the students and the movements that are going on recently, and their energy and their passion, and I think they will be able to accomplish some things that maybe some of the adults have not been able to accomplish.
Well, it's very inspiring, I'll say that.
It certainly is.
We only have about a minute left, and I have to read a little closing at the end, so whatever we talk about next is going to be cut short, but is there any last minute thoughts you want to share? I know there was a criminal reform bill and some other things, but unfortunately we don't have a lot of time.
Right. Well, the criminal justice reform bill did a lot for adult criminal justice reform, and it included a lot of my juvenile justice that I've worked on a lot for as well. I guess if I have any message to people, if you have any questions or any concerns or even comments, never hesitate to call my office. We are available either for me or my district director, Pooja Mehta. I have other folks working on helping me out for district concerns and needs, whether it be a specific concern they're having or let me know what their thoughts are on a bill. Never hesitate.
Well, thank you, Karen. Well, there's so much more to talk about. We'll have to have you back sometime. I really appreciate you coming today. And thank you for joining us for this program and hearing about our State Senator Karen Spilka and all her work. For more information about our State Senator, visit her website listed at the end of the show. For more information concerning all about Hopkinton, find us on hcam.tv. If you or someone you know is having an impact on our community, we want to hear about it. Send an email to jim@hcam.tv, and perhaps you'll see them sharing their story right here on All About Hopkinton. I'm Mary Arnott, and thanks for watching.
Did you know there are other ways to reduce your pain besides taking medications? For example, mindfulness. I'm Dr. Mike Guidi, family medicine doctor based in Essex County. I use mindfulness techniques with my own patients during office visits, and I'm here to tell you how you can prevent addiction. It is a way to train your brain to manage pain. Reducing your pain through mindfulness could mean you need less medication or a safer type of medication. It can also help you reduce your stress and recover from past trauma. That means you become less likely to develop an addiction, whether opioids, alcohol, or any other substance. In brain research, we scan people's brains before they start practicing mindfulness, and after they've been practicing it daily for 8 weeks. We see actual changes in the way their brains are wired. We see those people drawing more on their judgment and reasoning skills, resulting in safer behaviors. Massachusetts has great resources about effective mindfulness techniques. To find out more, go to massmed.org.